Hello, my name is Giselle Zendejas. I'm a student physical therapist assistant from CBT College, and today I will be answering the questions in the given scenario. So, in this scenario, there were some laws that the PTA Ms. Rodriguez did violate. The first one being healthcare malpractice. So, Ms. Rodriguez owed a legal duty of care to this patient, and she felt that by not obtaining an evaluation from the PT first before beginning the session. And then she performed random exercises without having any background information as to her muscle strength or range of motion. And she also didn't meet the standard of care because she allowed her patient to fall and didn't provide any first aid as well. And then another law that Ms. Rodriguez violated was failure to report or document the incident of her fall. When her patient fell, she decided to not report the incident. To answer the second question about what Ms. Rodriguez should have done differently, when she realized that there was no prior evaluation, is that when she realized that there was no evaluation, Ms. Rodriguez should have informed the patient that she is not able to continue with the session without having an established plan of care and eval from the PT first. She should then call the physical therapist and let them know that there's no initial evaluation and allow the physical therapist to perform this first before proceeding with the physical therapy session. To answer question number three is how else did Ms. Rodriguez fail to provide adequate care to the patient after the fall is first she failed to provide adequate care to the patient after the fall because she didn't provide any first aid to the patient when the patient had fell and sustained injuries and bruises. This further enforces that she was negligent to the patient and failed to uphold her legal duty of care that she owed to the patient. She also failed to document the fall and notify the physical therapist, and also failed to realize that she had histories of strokes and that her balance was very not good. Therefore, she was a very high risk fall. To answer question number four, in this scenario, I believe that Miss Rodriguez would have went ahead with the treatment because one, she was not properly trained, and having no proper training, she failed to realize the red flags and proceeded with the session anyways. She also would have went ahead with the treatment because there was no supervising physical therapist there to stop her from proceeding. And Miss Rodriguez is clearly liable and at fault in this given situation. And then to answer question five as to what I would have done differently, in this scenario, I would have notified the patient that unfortunately we will not be able to continue our session because there is no initial evaluation. I would then notify the physical therapist that initial evaluation needs to be done before I can proceed with the session. I would also make sure to look into any range of motion or MMT tests so that when the eval is completed, then I can tailor the exercises that match the assigned plan of care and make for her. I would also make sure to investigate any comorbidities that could affect her physical therapy session or her safety, such as her stroke and her being a fall risk. And I would also make sure to provide first aid if my patient were to fall or have any accidents, and I would immediately document all